Is there anything that you think the doctors and psychiatrists are doing right now that you believe simply are not working with people with chronic health issues, depression, anxiety, withdrawal? And also, if you could touch on them prescribing things such as Suboxone.
So I would say this. I would say what they're doing wrong in psychiatry today. Are you familiar with Abram Hoffer?
Oh yeah.
Probably
Oh
so.
yeah, for
Yeah.
sure. Yeah.
Yeah. Total pioneer in this field.
Niacin, schizophrenia, stuff like that. Yeah.
Yeah. Niacin and schizophrenia and his adrenochrome hypothesis. But he was a psychiatrist. He actually is a really great book for
Yep.
those of you that are interested in reading more about him called Adventures in Psychiatry.
Hmm.
It's just a great overall. It's not super deep heavy in the science, but it's a great book of his work. And Dr. Hoffer was a psychiatrist. And one of the things that I can credit him for in a really big way is he's one of the founding fathers of the term orthomolecular medicine. Orthomolecular means right molecule.
Yeah.
And niacin is an example of using the right molecule
Hmm.
because niacin affixes to the opioid receptors in the brain, and it affixes to the addictive receptors in the brain, and it saturates them so that they're being saturated and they're being activated without the drug having to be present. This is why that works so well. But how did they find all this out? How did doctors like Dr. Hoffer and Osmond, how did they find these things out? They did testing, they did biochemical testing, they did analysis.
Yep.
And so when you ask me, what are doctors and psychiatrists doing wrong today? In the field of psychiatry, it's a purely subjective field.
Hmm.
It's a subjective field, but it uses objective chemistry as a tool based on subjective conversation. So you sit down, you talk with your psychiatrist, and they say, well, let's try this.
Right.
Let's try that, but not once. If you go to a traditional psychiatrist, will your psychiatrist tell you, let's measure your dopamine,
Right.
let's measure your serotonin, let's actually get objective data by which that we could understand how better to make the recommendation. Even if they were making the recommendation of a drug, different drugs have different mechanisms of action.
Yep.
And so if they're making the recommendation about a particular drug, wouldn't you want to know that if you were recommending an SSRI, that
Right.
person's serotonin level was low instead of their serotonin levels were perfectly normal, and the SSRI probably won't do much for them. So my point is objective data, objective science is lacking. And but unfortunately, they have the prescription pad to write very powerful mind altering, mood altering medications that have the potential for a ton of side effects. I mean, the example, if we're talking about, diseases like bipolar, schizophrenic, schizoaffective, depression, drugs like Geodon and Abilify and SSRIs. I mean, these drugs cause massive malnutrition. A lot of them are linked to the development of diabetes, which, by the way, diabetes begins the process of addiction because when blood sugar is low, it creates gravitation toward an increase in pain and increase in inflammation. And so it pushes people more toward that addictive quality or that addictive side. So it's like, again, I think you get my point, is that if we have zero objective chemistry analysis, yet we're using very, very potent drugs that have very, very potentially debilitating effects. And that's the standard of care. And
Yep.
if we look at the success rate, what's the success rate in treating schizophrenia and bipolar disease? What's the success rate in treating schizoaffective disorders or ADD or ADHD? It's
Right.
virtually 0%.
Yeah.
Right? There is not a success rate. There are people that do well for a time on certain medications,
Yep.
but generally speaking, the body overrides those medications if we create a scenario where the drugs quit working because
Yep.
the body's developed an override around them, and then the drugs just change, right? So there's really no success. There's just a constant management, and the goal of healthcare shouldn't be to manage somebody's problems.
Right.
The goal of healthcare should be to empower somebody to understand what they can do to make meaningful changes in their life, to become self-aware, right? And self-serving to their own health, right? And that requires time. It requires education. And, psychiatry today, they do spend time with their patients.
Mhm.
Unlike your standard medical doctor who you might get 5 minutes, they're swirling in and out the door. But the time that they're spending talk therapy, if it worked, we wouldn't have mental disease anymore.
Yep.
You know what I'm saying? Like if talk therapy worked, if going into a room with a complete stranger and spilling your guts out worked,
Yep.
we wouldn't have chronic illness the way that we do mentally, and we still have a massive quantity. We have probably the highest level of chronic mental illness that we've ever seen in the history of mankind, at
Yep.
least in recordable history, and that's with the current therapies and the current drugs and the current standards of care. So those things are obviously not working. It's time to make a change.
Yeah. No, that's funny that you brought Dr. Hoffer up. I took a abnormal psychology class a couple years ago, and I went up to my teacher afterwards because I was doing a project on schizophrenia, and I said, this Dr. Abram Hoffer, he's treating niacin or treating schizophrenia with niacin, and she said, no, that's impossible. If that was true, then they would be using that today. And I was like, oh, okay, kind of funny.
Well, what happened is it was really somewhere in the 40s and 50s that this was actually, kind of when penicillin came on. There was the race to find a drug for everything because it was so profitable, the production of that medicine, and penicillin by its own merit saved millions and millions of lives, right?
Mhm.
But it also made a lot of money. And so it created a pharmaceutical craze, if you will, that instead of looking at vitamins, minerals, and things that were actually essential for the body to function,
Mhm.
right? Because there's a reason why we call them essential nutrients.
Yeah.
There's 40 essential nutrients: vitamins, minerals, water, carbs, fats, proteins, nucleic acids, right? Those are the essential nutrients.
Mhm.
And we kind of quit focusing the study on those things in the endeavor to seek out new chemical means to manipulate the body.
Yeah.
The next wonder drug, and it's a disfortunate that was the case,
Right.
because the researchers before, again, the 30s, 40s, 50s, there's stellar research, and a lot of times, if I really have a question I can't solve in my practice, I dive into that, because those guys were hardcore chemists.
Right.
Those guys, I mean, the Linus Paulings of the world, those guys were hardcore chemists. They dealt in fundamental sciences, and they had great research. Whereas what we see today, unfortunately, there's not a lot of funding, there's not a lot of money
Yeah.
going at nutritional research, and there's so much. Even if we do have good research nutritionally today, but a lot of it is squashed, meaning there's oppositional research that's done on purpose to try to squash it. I'll give you an example. I was invited years ago to University of Texas Medical Branch in Galveston
Mhm.
to participate in a study on the use of CoQ10 in congestive heart failure.
Mhm.
And because that's one of my areas of expertise, and the doctors there had designed the study, and they wanted to bring me on board. And part of why they wanted to bring me on board was because they wanted me to donate. I have a supplement company, and they wanted me to donate my CoQ10
Mhm.
and for the study. So they gave me the study parameters. We were having this meeting. I looked at the study parameters, and I looked up and I said, "Why did you design the study to fail?" And their faces turned super red. Like I caught them, and they didn't realize. They thought, here, this guy, what
Yeah.
does he know? He's not an expert.
Yeah.
Anyway, their study design was designed to fail. And so I looked at them and I said, I'm not going to participate when you're going to try to defame CoQ10, when we already know CoQ10 has been used in numerous studies to treat congestive heart failure, to treat hypertension, right? To treat mitochondrial dysfunction, and it works.
Right.
And then their answer to me was, well, we're just trying to make sure it's safe. I said, that's already been done. We don't have to
Yeah.
go back to that. I said, I'm done here. But my point is, that's oppositional research. You actually have drug companies fund research that's designed to fail to make a supplement look bad. We've seen that with vitamin E. We've
Yep.
seen that with fish oil and a number of other nutrients.
Yeah.
And so you get this conflicting story. And so like the person on the internet who's just trying to figure out how to be healthy, they come across an article on vitamin E causing cancer,
Right.
and it's based on a study. But what they don't know, because they're not scientists, is that study was designed incorrectly,
Yeah.
and it doesn't really cause cancer, and it's just very misleading. But
Yeah.
it scared them,
Right.
right? And so it created enough doubt in their mind to make them think, oh gosh, vitamin E is dangerous. Yet at one side of their mouth they'll say that, but then on the other side of their mouth they'll say, well, yeah, give me that vaccine, or yeah, give me that
Right.
drug,
Yeah.
right? When all drugs come with a cost,
Exactly.
vitamins don't. I mean, unless you're just, how many people have died that have been reported in the medical literature from a vitamin overdose. It's
Right.
very, very few, right? I mean, you look at how many people died last year of aspirin, and it was about 13,500 people
Right.
from over-the-counter aspirin.
Yeah.
You know,
And
that
God
is
forbid
far
if
more
you took
dangerous than
vitamin
the
A or vitamin
vitamin.
D. Yeah.
Yeah.